Hey everyone, this is the Art Beauty Podcast where we tell the real truth about the fake shit. And our guest today basically almost does not need any introduction. But for those of you who've been living under a rock, we've got the fabulous Dr. Dennis Gross. He is a board certified dermatologist, a dermatologic surgeon, still practicing dermatology, and of course, the founder of Dr. Dennis Gross Skincare, which has won so many awards. And thank you so much for being here today.
You bet. It's so much fun to be here. And we're going to talk about body.
We're talking about body. I love it.
Such a good topic.
I was going to say, you are a friend of the show. We've done podcasts before. You're a friend of most of our faces. Thank you. But I think that so many people do focus on the skin on our face. And I was just lucky enough to go to Florida. Here in the Northeast, it's winter. So,
Right.
And with COVID, I mean, I sometimes I don't leave the house for days at a time. I forget what the outdoors is. I forget what it is to show skin. But when I was in Florida, I was like, oh boy, and we need to really be taking care of all of the skin on our body, not just our faces. Because I think that your skin on your body really can give away signs of aging, right?
Yeah. Well, here's the deal. What you're saying is like what everyone's talking about. What's going through your head is what I'm seeing in it's so many patients coming into my practices. And the fact of the matter is that right now, they want to take better care of themselves. I think, in fact, I'm approaching 2021 as a year of self-care because people that I'm seeing in my practice, over 50% of them are now coming in for body work, which is huge. I mean, that was not the case a few years ago because people, I don't know exactly why, but you can now get skin on your body to look gorgeous and radiant and firm and younger, and the spots can come off, and you can get that crepiness to look better, and you can get rid of the acne and the keratosis pilaris and all that stuff. People want that. And so they're coming into my practice and we're doing that. And times change. So here we are with a lot more we can do for body.
Let's talk about what are some of the most popular body treatments that you're seeing people come in and ask for in your practice?
So in the practice, people are always coming in because they want firmer skin. I can just give you some examples, right, to add some real life to it. So I have people coming into the practice who are one woman came in, she does yoga, right? And she was telling me how, and she literally pulls up the leg of her pants and says, look at the crepiness above my knee. I never had this before. Okay. And she's starting to notice it. And I think she noticed it because she's seeing her leg in a certain position in yoga every day. And over the years, it's not that loose. And then people coming in because they want their arms to look firmer. People are coming in who have had sun damage on their bodies. Like you were in Florida, plenty of people go to Florida on a regular basis and they get lots of sun there. It shows. Oh
my gosh. And your décolleté is so prone to that. And if you have those sunspots there, it's not good. I feel for, and I can relate to the woman who came into your office, doing those downward dogs.
Exactly.
The other day I've got the Peloton and I was doing arm workouts and I started to notice there's just wrinkles in places starting.
Right.
There shouldn't be. Some of it's aging, right? And we have to approach that gracefully. But yeah, tell me, what do you think about that?
Well, here's the thing. What you're noticing is, what you're getting at, I think, is you're witnessing the signs of aging starting to creep up on you, right? And that's an important motto of mine. My motto is every wrinkle has a birthday, right? There is a day you wake up and you say, wait a second, where did that come from? I swear that wasn't there yesterday. You know what? It wasn't. Right. So I think that what you're starting to see in your forearm, people are seeing this on your bicep area. This is how it works. So the truth of the matter is that what I'm saying, what I say to people, what we do is let's get at it now. Mm-hmm. Let's fix it while it's young. By the way, there's still hope if it's not for you out there. And you can stop it from getting worse by preventing it because it's all predictable.
Okay.
And so what I do, I'm a dermatologist, I'm a former skin cancer researcher, I'm a scientist, and I do make products, and I have a very scientific approach to things, and I think it's been working out, and because people are doing well. And I think what you need to do is you are confronting it. Go for it. There are things to do. Let's get at it.
So, okay, so let's start with crepiness on the skin, right? What are things that we can do to, to get at it, to attack it now while it's still young, or even if we're like have more advanced crepiness? What are our options?
Build your collagen.
Mm-hmm.
That's it. That is the dermatologic recipe. Okay, because it's all about the collagen, which is the protein in skin that gives skin its firmness, its thickness. It's the fibers that give skin support and structure. Okay.
Right.
As we get older, right? Genetics, wear and tear, sun damage, all the things that break down skin. That's going to deplete your collagen. Right. The key is, therefore, build back your collagen. Okay. And you said, so you're starting with crepiness. It doesn't matter. Here's the thing. It's all about collagen, fine lines and wrinkles, grooves, jowls, laxity, droopiness, crepiness. Right. They're all go back to this common problem, the common cause, which is your skin needs more collagen. And you can do that, and you can't drink it. Okay.
I was just going to say, because I'm with you on that one. I've talked to a lot of people. The drinking of the collagen.
Yeah.
You're a nay.
Not a nay.
You're a no.
It's ridiculous science. It's almost embarrassing. That's how unscientific the claim is. It's not even subject to vote. It's like you ask anybody who knows anything about science. I'm going to say some words to you real quick if you want me to. Look, here's the deal. What's collagen? It's a protein. What's a protein? What is it? You eat protein all the time. You eat steak. You eat salmon, right? Chicken. That's all protein. The body, if you put a protein in your stomach, it digests it.
Right. So the stomach acids are going to break down any protein that enters the body, whether it's, pure collagen or, a steak dinner.
Exactly.
Right.
So how does it get to your skin in the form of collagen? It needs to be in that state of collagen. It's got to be a protein. It's not the mishmash digested stuff. It's the actual structure. So that's why you can build back your skin cells can make more of its own collagen. That's the key. That's the only way to go.
So, okay, we're not going to drink it. We're not focusing on collagen supplements. What do we do? I know that there's so many products to help build it in the face, but what can we do in the body? Are we talking about like in-office treatments, at-home treatments?
Yes, both.
Oh,
so first of all, we have a new body peel. It's something you can do at home. That's a peel. Okay. And that is something that has ingredients that actually stimulate the production of your own collagen. Scientifically proven, researched products that work to build back collagen. So that's number one.
Okay. And I just want to take a moment here for anybody who doesn't know, this is kind of like the sister to the alpha beta peels for the face, which are award winning. They're the number one at home peels. I was super psyched to get this because I love the at home. I love the alpha beta peel. I've used it for years and years and years. And these are amazing. Here, I can show you the box, but sorry, the box is open because I've been using them. I'm psyched. So what are the ingredients in here that we can use or that are helping with the collagen?
Well, the first thing you need to understand is that there are acids that firm the skin, okay? Alpha and beta hydroxy acids. Mm-hmm. And when you do that, what happens is, it's a little complicated, but here's some of the science. The first thing is that some of those acids absolutely have been scientifically proven to stimulate your collagen. So there are acids in here that do that. Now, here's what we needed to do. We needed to make sure that those acids were not used as exfoliators. We created exfoliators that took away that top layer of dead skin that were other means by which, yes, a little bit of the acids do work in that regard, but there were enzymes, right? The key difference between the skin of the body and the skin of the face is the body is 2 to 3 times thicker. So so not only does it tolerate stronger measures, it needs it to get results. So we exfoliate with a high-powered exfoliating process. This is not for the face, folks, okay? After that, we let other ingredients now get down deep into the skin where the cells that make collagen in this lower layer of skin that's called the dermis. That's where they live, and we now open the floodgates through exfoliation and let those ingredients go deep and make your skin start to make more of its own collagen. So glycolic acid, bakuchiol, another incredible ingredient, okay, a sister to retinol.
I've been hearing a lot about bakuchiol. Can you tell us a little bit about what that is?
Bakuchiol is a product, is an ingredient that is also derived from vitamin A. So is
Okay.
retinol. So is retin A. Okay. So are tretinoins. Okay. All these names you've heard of. What they do is they have a couple of benefits to the skin. The point is, bakuchiol is another one of those vitamin A derived ingredients. Okay. And yet at the same time, it works a little differently. And we tested retinol here. We found that bakuchiol won out. We did clinical studies, clinical trials, like how you know what clinical trials now in this day and age, what those are all about. So we did that. We subjected to expert opinions. We subjected to molecular markers, looked under the microscope, looked at cells. Bakuchiol stimulated collagen in this particular product in a superior way than the other vitamin A derivatives, okay, including retinol. So that's what it does. It does other things, but that is something that the most important answer to your question is that there are ingredients that go deep that stimulate your own collagen.
Now, I know with retinol, we have to be careful. I was somebody who I've always sung the praises of retinol. And recently, I don't know if it's just because of the winter, I had to really stop using them so much because it was really hurting my skin. And as we've talked about on our prior podcast, too much damage to the skin, too much irritation, inflammation is counterproductive. So I've kind of pulled back a little bit right now because for whatever reason, the light retinol that I'd been using for years just it wasn't working for me.
There's no downtime with this product. That's a very good point. That's how we keep it gentle. There is no peeling that you actually see on the skin. It all comes off on the pad. It's crazy.
Okay.
And then you'll see it on the pad. You say, what is that? It turns a different color. There's deposits on the skin, on the pad from your skin.
Yeah.
It's one of those savory moments.
It's we love those moments. So let's be honest. We all love that it's kind of gross, but it's also kind of magic and science.
Totally.
I'm glad you pointed this out because this is different. So the alpha beta peels for the face, like you said, are peel, but this is actually a body treatment.
Correct.
It's not just a peel. So, so how often are we supposed to use this? And what do you think is the best way to use this now to get results?
Well, the thing is, you have to understand, well, what are the results that you're looking for? And here's what you will get from this product. So to answer your question, you start off by using it, let's say twice a week. Okay. Mm-hmm. After that, you continue with it twice a week, or if you want to just use it once a week because that's all you need, great. But it does so many different things. So a lot depends on, well, how much do I need to maintain it? I'll give you an example. So the first thing is that there's this thing called radiance, right? You want your skin to have this. It gives your skin this beautiful, dewy, radiant, super hydrated look. That's just, and that happens in 3 to 4 minutes, right?
Yeah.
Which is what you want. Facial products, the alpha beta peel for the face does that. It does it right away. This is a product that gives your skin incredible. What it does is it exfoliates off that top layer of dead skin, and it does it with a triple complex. And then after the top layer is in, it infuses the skin with 6 different super powerful hydrating ingredients, which hydrate your skin. That alligator skin look that people use moisturizers day in, day out, and it just comes back over and over again. Their skin looks great with a moisturizer, but here you go, you get dry again the next day. That's because you need to get off the dead skin. You exfoliate, and then you hydrate internally intensely. Internal, external, and then bring atmospheric water into the skin as well. That's how it works. You get this beautiful radiance. Exfoliation and hydration together, it gets radiance.
Radiance.
That you'll see right away. And you probably don't even need a moisturizer. You don't.
But in terms of wanting to do long-term, because let's see, this has, is this something that we're just going to sign up and that you really, recommend doing at least once a week, sort of forever?
Oh, you will see it. You will become addicted to how beautiful your skin is. And what you're talking about, how that's the next frontier. And so here's the other thing. It works on other conditions. Like there is this condition where people get on the side of their arms or on their thighs, this little red, grainy, bumpy kind of surface texture change. It's called keratosis pilaris. As a dermatologist, I can tell you it's very challenging to get that to work, to fix that. This gets rid of it. It exfoliates it. It soothes it because the redness is there. We have a treatment for it that you can do at home. It works for the crepiness. Like if you're trying to build collagen, like I said, that's something you have to stay on. It's going to, you got to use that box. It's going to take you like 2 months, but you'll see it firming right away. You get hydration, plumping. That's what that is.
Right.
And then firming. And then you have other things. You have acne, let's just say. If you have acne on your back, it helps that immensely. Exfoliation, decongesting all those pores.
I do want to say, so when you sent me these, and for anybody who follows me on Instagram, no holds barred here. I was really excited because I just got this Peloton, and no matter what, I will get the bumps down the butt. So I ain't too proud to say it. This is great for that.
Totally great.
The back knee, butt acne. Listen, it happens, and we keep it real here. This is great for all my Pelotoners out there.
Yeah. Ingrown hairs. That's another huge thing. You know? And so if you have ingrown hairs in a prone area, use them there.
Wow, really? And it's gentle enough for that area for the women?
You bet. You bet.
Great.
The thing I want you to know is it's not for your face. And for the neck, by the way, the face alpha beta peels. Let's use those there.
Yeah. And what about you think for the deck? Because that skin too can be a little bit sensitive, but you want to use this. This is what you want. Okay.
We did the clinical testing, and my goal was to make sure any part of the body it worked on, no downtime. It works great on the décolleté. And it helps discolorations, you know, really important. That's another huge thing. Those sunspots you were talking about.
The hands also, folks at home, don't forget your hands reveal your age.
There's ingredients in there that are science proven to break down that pigment and stop its hyperactivity that's overproducing it.
Right.
That's a key thing. The science it's such an easy thing to use, you know, but the science in there is really, it's pretty loaded.
I want to thank you because I love that you're always at the forefront. You're always kind of, pushing the boundaries. And also because you're in practice, you listen to what we, the consumer, and your patients really, really want. I do want to ask you, okay, so, and also wait, obviously we want to be putting sunscreen on areas on the body. Don't forget that. Definitely. Every day.
All the time.
What are some of the in-office like procedures that are hot right now?
Okay. Well, for every single thing we just reviewed, there's a treatment. I'll give you an example. Ulthera for collagen production, right?
On the body.
On the body. We're doing it on the body. We're doing it like, again, the crepiness over the knees. We do it in the face. Oh yeah. That's its claim to fame. But you can create settings that are really great for firming up body skin. By the way, even if you do that, I still recommend doing something at home. It's going to help. Is it going to change you back to the way you looked when you were, much younger day? I cannot promise that, but there is no question that doing something at home, even if you do Ulthera, is super important. But
sure.
Ulthera has been a real important addition. Okay. That's number one. And how about those brown spots? We have lasers that are just for the color brown. Okay.
Right.
IPL laser, YAG laser. Those are the two top ones. We have both. I like them for the subtle differences. Like, so the IPL, for example, if you have brown and a little, how in the chest you get some redness too, like a little bit of that brawny look, right? So the laser, the IPL, if you have that, we do that look that works on both red and brown. But and then sometimes you have like just real hardcore sunspots. We might use the YAG laser, but that's an easy one to do. That's big now.
Yeah.
Other things.
And like what, like, so Ulthera is expensive.
Yes, it is.
It's very costly. I wonder this too, because my mother, God bless her, she listens to this podcast, but she's in her, 70s. And she was like, is Ulthera something that'd be right for me? And I was like, I don't, I've talked to a couple of people. I don't know. I think that you still need to, because Ulthera is great for stimulating collagen production, right? But if your body's not in a collagen stimulating, is it good for people in their 70s?
You're right. You know what? That's a great question, because there are a lot of people who ask that. I must tell you that you can improve your skin on a percentage basis. Right. In other words, if you're right, as you get older, we talked about how the only legit way to build collagen is to make your skin stimulate it to make more of its own.
Right.
It's true as you get older, the ability to revive those skin cells to make more isn't as good as it was, in your 40s or your 50s, right? But you can definitely do it. So what happens is you say to people, if you look 50% better, not 50 years younger, right?
Right.
If you're happy with that, you paint the picture in their mind, and then you tell them what's realistic. We do stretch marks, for example, or women who've had babies, and the skin is loose. We confirm that up. But again, different degrees. You got to tell them what to expect and be realistic.
Like, how much can you tighten on? I have not had a baby, but as I continued, believe it or not, to like work out a little bit more, and I feel like things are tightening up. There's still like that. The skin on your stomach is a little bit loose,
Right.
just
That's
aging.
right. So
Ulthera can really tighten that up.
here's the thing. Let me tell you.
Give it to me.
There's also lasers for fat. I love sculpture. I like the heat lasers that destroy fat, because those also firm the skin.
Okay.
They help break down the fat and get rid of the fat, right? But they also, because it's heat mechanism, not cold, can firm the skin. So sometimes you got to sort of be, you have to make some decisions for people and help them see it through. Not to make things too complicated, if you have stretch marks, then there's one particular laser that I love that really can firm up the skin. And to be even more complicated, if your stretch mark, it needs firming, if it's red or if it's white, there's a different treatment for both.
So in office, number one, it sounds like you really need somebody who knows their stuff, probably also has a bunch of different devices too.
Honestly, that's the thing. You're right. The truth, what I've learned is that for every problem, you need a specialized laser. There's no
Yep.
such thing as like one laser that's the jack of all trades, because then it's the master of none,
Right.
And by the way, it's one of the ways that people, who don't have busy practices, who might want to just try to be economical, they'll do that. But as you can see, right, they're like, everybody has, each laser has its own specialty.
Right. Listen, I know because I've got, I'm lucky enough to be in this business, and we're not poo-pooing anybody out there, but as an educated consumers, you should do the research, find out if the procedure that your doctor wants to do is really the best to solve the problem that you're having.
Yes, which is why I love doing podcasts. This is
Yeah.
why I love educating. This is why
Yeah.
we do master classes for my products, every
Yeah.
Mondays and Thursdays, and we do Instagram stuff, all about education. We, all about, we even do free one-on-one virtual consults, because what we want to do is we want to really let people understand this kind of stuff that allows them to pursue. And it's very complicated. It's a confusing thing to navigate, like what to do, what's best. I mean, how do you even begin? Education.
And this is why I do the podcast, because we also know that sometimes, I want to ask people like yourselves who are in the field, who are doing stuff, who on a platform where we're not afraid to be like, listen, the marketing companies are trying to sell you this for this, but it really doesn't work. You really need something different. And that's what we're trying to do. There is a lot of confusing. I mean, I've been in this business for years and I still get confused sometimes. So
I hear you. And by the way, so how do I do it? What do I do? Well, I do clinical testing in my own practice, and I'm never anybody who jumps on the bandwagon with, my motto is I want 10,000 other patients to go first. And I want to get the lowdown on that laser from all my buddies out there, and like, tell me the scoop. Is it working? Give me the skin type. What % difference? What are the downtimes? What's the downside? What didn't you know that you didn't expect? I get that, and then I critically evaluate the research. So I don't believe that you should just because you hear something is bigger, better, newer, folks. It's not that way. I wish it were that simple.
So is there anything that out there, and you don't have to, but is there anything out there that you're like, no, I really don't recommend this? Like any of the procedures that we've probably heard of for body that you're like, pass?
Well, look, I think that, I think there's a lot of fluff. I don't think it has to be hardcore stuff. I mean, I don't know how much dermaplaning really helps, for example, that like scraping your skin with like an instrument.
Can I just stop you there? There is a dermaplaning device that I love. I've talked about it on here, Dermaflash. She knows I love her. She's always like, it takes care of the dead skin cells, but it's not it gets rid of the peach fuzz on your face. And that
peach fuzz is different.
But that makes your makeup look smooth. So I'm with you on the dermaplaning. It's not something
and I hear in the peach fuzz. I hear you. That's a really good specific thing. And women hate that peach fuzz. So that's
they do. The vellus hair, getting rid of it, but cool. But dermaplaning just in general, it's
for collagen production. I mean, I get that
collagen
question.
production.
Yes.
That seems like a stretch to me.
It is a stretch.
Okay.
No, that's what I'm saying. You talk about marketing companies. I've seen this.
Yeah.
Dermaplaning for collagen production and firming the skin. No, peach fuzz, yes. A little bit of glow, yes.
Right.
Harmless as can be. Oh, no, I'm talking about that wild and crazy expectation that you can sometimes, the consumers sometimes like thinking that's what they're, I have patients coming in doing it for that reason, asking me, do I think it's going to work? Is a replacement for collagen.
It's like, no. If you want your skin to look tighter with a knife, we're going to actually need to make some incisions.
This is true. That's the knife, right? So I hear you.
There we go.
So yeah, and other things. Look, I don't think that. I think you got to be a real advocate for people, and you have to educate people to ask the questions, and make sure it's you. I think that I think, for example, facelifts, for example, just pure facelifts. The number of people getting facelifts is actually coming down,
Right.
And there are people who are, there were days, the people who are getting it at a really, really young age, I think that's over,
Do you think the numbers going down because there's more technologies available, things like Ulthera,
Yes.
to help postpone and maybe not even, listen, Ulthera is super expensive. It's something that I am now adopting into my routine because I do believe I've done it once. I saw great, very subtle, but to me, good results. And from what I've heard, it is sort of the gold standard right now for postponing a facelift and maybe even so that you never really need one.
Yeah. Definitely technology, treatments like that will maybe never lead you to a facelift. And maybe that's what's happening. Okay.
Right.
But I want to make another point very clear to people, which is that, what you can do at home now, don't underestimate.
Right.
Right. There is real research that shows like retinol, vitamin C, alpha and beta peels, right? All these things really firm your skin and get your skin to look firmer and help lines and wrinkles look better. That's bona fide stuff. And so that's where I focus on making products that really deliver results like that. And people, I'll tell you a quick story. After lockdown, I had people who hadn't seen me for like 3 months. Okay. It was incredible how people who came back, those who were using at-home products looked like they didn't skip a beat, and those who used nothing at home looked like they aged quite a bit.
Really?
And the only difference was, and it's a controlled experiment, the people using stuff at home because they couldn't go to see a doctor, we were in lockdown, right? So the people who did the right things at home, stayed on their products, incredible, honestly. So religious use of great ingredients, great products, delivery systems that are super positively proven, okay, make a huge difference. Then there are lasers. And by the way, one more thing. Don't only think it's Ulthera. No. Ulthera, we're talking about, this is very important. There are other lasers, the whole world now of non-invasive lasers. I'm sorry if I misled you by thinking that it's all or nothing. We talk about Ulthera in the context of the body being you. For the face, there are other lasers that are way less expensive, totally affordable, with no downtime, that stimulate collagen beautifully. You may have to do them in a series, but we're still like talking about not like something that's going to lead you, be $6,000.
Really? Well, this is a body thing, but tell us what laser do you like?
Now I remember why we got on the track of Ulthera for the body. Yeah, forgive me. For face, well, There's 3D laser we developed, where we use it's the cocktailing of lasers. That's really been incredible. That's the new science. And by the way, that is part of what happens when you've done it a while, like I have. I've been doing this for quite some time. And I've learned that mixing and matching lasers is very much like mixing and matching ingredients in the alpha beta peel, or in the body peel, or in a vitamin C serum that has other things in it, like kojic acid. There's a synergy between lasers. And that is the combination that if you use lasers individually or together, they bypass the top layer of skin completely, and they work inside the skin where the cells that make collagen, that's where they live. It stimulates them, and it turns on your own collagen production, okay? So collagen genesis is a great laser for that. We like to use, even there's a setting on the IPL laser that actually works on collagen production. And depending on the person's skin type, some people, they have like looseness, like that you can actually see a sunken look in here. That's a very different problem than a person complaining about crow's feet. Think about it.
Yeah.
Totally different. So you have to know how to tap into these other lasers. But by the way, Ulthera we use on the face, but I will tell you, it's probably it's the laser. Either people say, I want to go right to the top, or they say, no, let me try to work my way up and see if I don't get better. And I'll tell them the truth. I'll tell them, you got lots of miles between where you are now and needing Ulthera. So there's a ton of things to do now.
Well, geez, when are you back in New York, Dr. G? I need to come over to you because
call my office.
It's expensive.
No, listen,
you coming back?
Yeah, definitely. I'm pretty booked till March right now, but I think that
it's worth the wait. I'm making a call right after this.
Okay, so there's no question, it's an exciting time.
Yeah.
And, we started out talking about the body, and the lasers on the body, that's the newness. Lasers for the face, the newness is non-invasive lasers done in tandem, sometimes 1 and 2 in the same session. Sometimes you come in for one, wait 2 weeks, and come in for the other. You got to sit down with the patient.
Good cocktailing. One last thing before you go, because a common problem with the body that I feel like maybe a cellulite. Right. And I know dermatologists say it's one of the hardest things to treat. But certainly there's always, every year, it seems like there's a new latest and greatest. I know there was Sulfina, and then there've been some other ones. Is there anything that you really feel like is moving the needle when it comes to cellulite?
I have not found anything.
Yeah. Okay. Fair.
And so I do not offer a service for cellulite in my practice. When someone calls, I will tell them I have nothing I really stand behind. And sorry, that is not something that client doesn't even make it past my door, because I don't want them to leave unhappy. And I think the state of our technology currently, there's no magic bullet for cellulite. We got to keep working on it. Cellulite is very different from fat, right?
Yep.
Very different. And it's a different type of tissue. It has bands of scar tissue in it. It looks like a basket weave, mixed into the fat. Different animal. So no, that's an example of, I wish that, and cellulite's an example. And maybe there'll be an upgrade for these lasers out there, but I have not found one that I really think is worthwhile to put my name behind.
Hey, thank you for being honest with us. I mean, that's why we do this, and we want people to know out there, because general consensus that I've heard is the same thing, that there are some products that might lessen the appearance temporarily.
Yeah.
But that there's nothing that's like,
it's hard.
It's hard.
Even liposuction for that was kind of ungratifying, because you start to actually see this when, liposuction, when you suck that little tube, you were getting like these, you actually start to see streaks of like where the tube was, like,
really?
like yeah, sort of like
where the cannula went in.
Yeah. Like track marks when your bike goes in a skid and you look back and you see where that skid mark was. That's what it looks like, kind of. So even that, I never did it, but I used to refer to it. I used to refer out for it, started seeing results for cellulite that I just didn't like.
Hey, All right. Well, hopefully these incredible
Sorry.
geniuses out there will figure something out there for those of us who are suffering that. But when it comes to overall radiance, when it comes to tightening, thank you so much, because you've really made it clear there are lots of treatments. Go see a board certified professional. And don't forget, thank you, Dr. Gross, that we do have these at-home treatments, that are not only going to help us boost radiance, but then can actually be working on the collagen at home, right in your own bathroom.
Yes, ma'am.
And what are the price on these?
I it's something like $54, I think.
So a far cry from 6,000. Let's just end on that.
Yeah.
Thank you.
Yeah. And there's, I don't know, like 8 of them in there.
Amazing.
Yeah,
Thank you so
box.
much. So, Dr. Gross, if people want to know more, obviously they can go to your website, is it Dr. Gross Skincare? Dr. Gross Skin,
Well, I have
Dr.
two.
Dennis Gross. You tell us.
Okay, so here's the thing. So my skincare brand is Dr. Dennis Gross Skincare. When you're coming to see me for lasers or for more education, and you want to learn from my website as a client, that's Dennis Gross, MD. That's my doctor appointment. That's where you would see me. That's also where you learn about lasers, and you learn about. I'll teach you on the website. By the way, what I love about the website is that I have found a way to actually help you predict your own future aging, and is like a little test you can take, looking at photos. It's all predictable, and because people need to have some clarity into what to prioritize, what to do. So I basically on the web, on both websites, I believe, you can actually take the test. You can download the book for free. It's called Your Future Face, and see where your aging pattern is going to lead you predictably. And then we talk about, well, what do you do for it now?
Thank you. I love that. I have been to so many, and gotten to talk to so many doctors, and I know, it's good to go into a doctor and they're like, well, what bothers you? But sometimes I want to go to somebody and be like, no. What do I need to be doing?
Yes.
What do I need to be doing to stay like this?
I get it. And by the way,
thank you.
It happens. That is a really great approach. Oh, you're so great, Amber. Thank you for doing this. I'm loving it. Thank you.
I love it. You are such a wonderful friend to the show, a friend
Thanks.
to me. Anytime you want to be back, there's always a spot here for you.
Thanks.
You have a wonderful day. And of course, if you've got any questions that you want me to pass on to Dr. Dennis Gross, you can email me at hello@artbeautypodcast. If there's anything you want to know about or see on the show, send us a message. And of course, you can find us on Facebook and Instagram at Art Beauty Podcast. And as always, we will see you next Tuesday. And I'm going to be seeing you in March.
Okay.